The patient's age, does it play a role in choosing whether to put a penile implant or not, and in selecting the type of penile implant? As we agreed before, age doesn't determine whether to get a penile implant or not. It's not about being too young or too old. The need for it depends on medical necessity. The surgical intervention is necessary, similar to appendix or gallbladder removal. I can't tell you to remove your gallbladder and you say, "No, it's mine, I don't want it removed." Or if you have a kidney stone that might harm your kidney, you say, "No, I'm fine with it, leave it be." The surgical intervention is necessary. Here, age is not a factor we can consider because the illness is not age dependent. Just as I encounter cases where a person aged 70 or 80 is in excellent health with no diseases, and a young man aged 20 has diabetes, severe venous leakage, fibrosis in the genital organ, and high blood pressure, the disease is no longer limited by age. It is not suitable for a young man, say 25 years old, who has been suffering from diabetes for 10 years, and has severe damage to the tissues of the genital organ and nerves, and is completely unable to have an erection and unable to marry. I would never say to him, "You're young, you shouldn't get a penile implant." Similarly, it is not suitable to tell a 75-year-old man, even if he is in good health and able to undergo surgery, that he should not get a penile implant because of his age. The need for implant is not determined by age. General surgeries are not determined by age, but by medical necessity. For instance, one cannot claim they are too old for an appendectomy, you have appendicitis, and must do surgery. Similarly, the decision to undergo penile implant surgery is primarily at the decision of the physician, not influenced by age. The crucial factor remains the patient's response to other treatments and the severity of erectile dysfunction. For example, a 70 or 80-year-old man with severe erectile dysfunction may still benefit from treatment despite his age. He improves a lot and comes to tell me, "Wow, thank you doctor, I'm doing well," so he doesn't undergo the operation. Then a young man comes to me without any medical condition, but takes medication with no improvement, and his life remains stagnant. He either separates from his wife or doesn't want to get married. No, this person should get an implant, so it's not suitable for an older man to tell him, "No, you're old, come and get an implant," and for a young man to be told the same. The decision is mine. I gave you treatment and you improved and are able to have a successful and satisfying relationship for you and your wife. No, if there is no response to the treatment and no improvement, we perform the operation, regardless of the patient's age. However, age might play a role in choosing the type of implant. A very elderly man might not be able to use the hydraulic implant, or he might face difficulties in using it, so we might install a flexible implant for him. Men aged 70 or 80 or more can indeed use a hydraulic implant and be very happy with it, as many people outside of Egypt, in the US and Europe, get implants at this age and are content with the hydraulic type. But here, for example, if a man is very old or has Parkinson's disease or weak nerves, the flexible implant might be more suitable for his case. Similarly, if a patient is very old and cannot endure a long period under anesthesia, we install the flexible implant, as it takes only about 20 minutes. Unlike the hydraulic implant, which might take 40 minutes or even an hour, depending on the circumstances. The anesthesiologist might advise against it if the patient cannot tolerate it. Even if we perform the operation under local anesthesia, its duration is limited. Therefore, the patient's age determines the type of implant, but there is no such thing as young people don't get implants or old people don't get implants. No, the disease is not about age. It's about whether the patient needs treatment or not. A young man might be taking medication for blood pressure, diabetes, and cholesterol, while an elderly man of 70 or 80 might not be taking any medication for anything. So the determining factor for me is the medical condition and the response to pharmaceutical treatment. Regardless of age, a man's response to drug treatment is crucial. Thank you, you don't need an operation, even if it's your wish. However, if someone doesn't respond to drug treatment, they must undergo the implant, even if it's not their wish, because by not doing so, they harm themselves and their partner. As we discussed earlier, sexual dysfunction is one of those diseases that patients cannot choose to ignore. In some illnesses, you have the freedom not to seek treatment because you are only harming yourself. If you are a diabetic and don't want to take diabetic medication, you have the freedom, but you are only harming yourself. The same goes for patients with high blood pressure and many other illnesses. However, when it comes to erectile dysfunction, infertility, or premature ejaculation, it's a different story. By not seeking treatment, you are harming the other person. It's not your right not to seek treatment. If you are suffering from erectile dysfunction, premature ejaculation, or infertility, it's not your right not to seek treatment. Otherwise, you shouldn't have gotten married in the first place. In this equation, you are hurting your partner, so you have to seek treatment. You must seek treatment. If pharmaceutical treatment doesn't yield results, you must undergo surgery. Yes, you might choose the type of implant and the timing of the operation, but the operation is a necessity, just like any surgical procedure. Why? When I tell you that you need a stent in your heart, you undergo it without hesitation. When I tell you that you need a pineal implant, you hesitate. Well, may God make it easy for you. Okay, fine, God willing. Now write down some medication for me. Okay, good. Your partner, who is suffering and has no say in your decisions, doesn't deserve to be neglected. Even if you don't want to seek treatment for yourself, seek it for her sake.